All right, here. So we're here with Deborah today. She wants to work on her knees. She's having knee pains. How long have you had knee pains?
Oh, I would say a good 8 years, maybe more.
Wow, 8 years. All right, so we're gonna have to do some movement today. See what's causing you the most pain. Okay. Okay. So let's have you stand forward a little bit, and then separate your legs a little bit, and then you're gonna squat down. Do the best you can. So go as slow as you can. See what you can do.
Afraid to, that's it.
That's pretty much okay.
I can feel it, yeah.
You start feeling it in both knees, or where will you feel it when you squat?
Especially this one. I don't, you know.
Okay, right knee is the worst one. All right, so the next step here, we're gonna have you go down the stairs. Go nice and slow.
Don't worry. I do go slow.
Okay. All right. Let's have you go up again.
Going up is worse.
Okay.
Like I have to have something to help me pull me
So
up.
yeah, so it's like you feel like you're losing the strength there. So out of all the movement that what you did, which one do you think was the worst that caused you the most pain?
Going up the stairs.
Going up the stairs. Okay. All right. You ready to start? Start feeling better?
Absolutely.
All right. Let's do it. 1. There you go. Breathe. 2. 3, 4, 5, 6, and 7. Beautiful.
Up, put your leg up. Go, 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 go,
Pretty good, pretty good. It's like,
yeah, it was no problem for her this time.
yeah. Go ahead.
Feels different. Oh my word! It feels so different.
What do you feel?
Yeah.
I feel like I'm moving in a different way.
That's awesome. Yes.
That's great. You feel more mobility in your knees?
Yes.
Amazing, isn't it? It's
I
great.
feel so better here.
Sit down. You just finished with the treatment. How do you feel?
I feel much better. I feel like my legs are light.
Awesome.
I feel different in here. I feel different above my knee.
Gotcha. Okay, let me have you sit down and stand up. See how that feels.
I felt a little click over
Yep,
here.
yep. We heard it.
Did you?
Yeah.
Yep, yep.
Yeah, it's going to be moving. You're gonna...
All right, so let me have you step forward a little bit. Step forward and separate your legs. And you're going to do a squat. Remember the first time? It was pretty hard to do.
Yep.
Let me
Remember,
see you do
remember
it.
how you said you couldn't do a squat? You were careful? You
Go
can
ahead.
keep your
Give it
legs
a try.
closed.
Give it a try. Don't sit on the ground though.
Oh boy, they're making noise.
Okay, it's okay.
Do you hear it?
Yeah.
Feel it?
I don't feel it.
Oh man, I can really. Wow.
Wow.
Oh
Wait.
my God.
Wow.
But it hurt when I got up.
Yeah, okay. Okay.
That's okay.
That's good. But I
Then
mean,
you-
we have improvement. You went down because last time.
Okay, you doubled in a squat within an hour.
Yeah.
I
Yeah,
could
you're gonna
not
feel,
do
yeah,
that.
you're gonna feel different things, but you can see how much your muscles, and we're trying to reset the pattern of your knee mobility. And when you can reset this and you go through the procedure, you're gonna notice I have more mobility and it doesn't hurt.
Yep.
Yeah.
And this is the proper spacing and the joint. Now we have the job of keeping it that way.
Yeah.
Okay.
So we want you to do we want her to walk down the
Yeah,
stairs.
down the
I want you to
stairs.
walk because I remember you said you had problems walking up the stairs.
Up is
Yeah.
bad. Oh, I feel pain there, but.
It's gonna feel light.
Ah.
I know you're gonna feel light. So
Ooh, no, it hurts still.
okay.
Yeah.
And go up. Let's go up.
It still hurts.
Okay. Okay.
So how was
Is
that?
gonna go away?
It takes time. Yeah. So I mean, you're getting more mobility. You're moving better. You definitely squat much better.
Yeah.
Much better.
Much better. So maybe a few more treatments and the stair. The stair I think
You
is
mean
more.
like what we just did?
Yep. The stairs is more of a strength. You just gotta get your body used to it because you're not doing it normally.
Okay.
So, but the mobility and the walking better, that's what we
Yes.
want to see.
We're
Yes.
gonna
Just
have to-
seeing that improvement tells us that you're gonna be moving better, right?
Okay.
Because once you start moving better, and you start doing the therapies at home, right? You start doing. This should be easy,
Okay.
right?
See,
All
we
right.
I would love to
we
be
just
able
showed,
to.
We just showed you that you have the mobility. What you're saying is I don't have the strength.